Phase 1 of the new emergency department at Alamance Regional Medical Center is open. We'll give you a tour of that. Plus, we'll check out what's new on the spiritual side of things at Annie Penn Hospital. All that and more in this month's Code View. Check out the new emergency department at Alamance Regional Medical Center. We got a look as the final touches were being put on the project. Phase 1 adds 37,500 square feet of new space and features 4 trauma rooms and psychiatric space. The old emergency department was designed to serve 43,000 patients. The new one will easily be able to care for the 70,000 expected next year.
What we really hope is that no one will leave unseen, that we'll be able to get people in, get them triaged quickly, and get them into the process without any backups.
One unique feature was the top request of staff. Every treatment room has its own toilet. Phase 2 adds a fast-track section where the old ED was. 5 larger replacement operating rooms opened in Phase 1. 4 more of those open at the end of Phase 2, which should come early next year. Emergency department nurses at Wesley Long Hospital hope to shorten the time it takes to treat patients coming through that department. They are involved in a breakthrough project that has already shaved 21 minutes off of the time it takes a patient to get to a hospital room.
So what we're trying to do is shave that time off from the time the doctor says you're ready to go to the floor, to shave that time down to 30 minutes. And we know that this one delay actually really drives our patient satisfaction scores for those patients coming through our emergency department.
The main feature of the Breakthrough Project is a nurse dedicated to getting patients out of the emergency room and into a hospital bed. When it comes to nurses, 65% of the nurses at Cone Health have 4-year college degrees. The National Institute of Medicine recommends that all hospitals bring that number to 80% by 2020. A major way to meet that goal is to help associate degree nurses get that 4-year degree.
The Office of Fund Development is working to raise $600,000, the equivalent of 100 scholarships for nurses who have an associate degree that want to return to school for a Bachelor of Science in Nursing degree.
Porter says keep an eye on Cone Connects for information about how you can help meet the goal of funding 100 nursing scholarships. Fundraising allows many projects that Cone Health just doesn't have the money for. The new chapel at Annie Penn Hospital is the result of a $39,000 gift from the Annie Penn Hospital Foundation. The old chapel was built in 1963 and sat in a part of the hospital no longer used by patients.
For our patients, their family, and some of our employees, it was not readily accessible to them. So we wanted to relocate the chapel to the main lobby, so it's in the main lobby right across from the gift shop, to where more patients and families and visitors could access.
This new, more spacious chapel sits right off the main entrance on the hospital's first floor. Congratulations to Moses Cone Surgery Center. Not only are their patient satisfaction scores routinely in the 99th percentile, but they're celebrating 25 years of quality care for their patients. That's it for this edition of Code View. I'm Doug Allred, and I'll see you next time.